Hey everyone, welcome back to another video, and today we're talking about the difference between subcutaneous injection therapy and pump therapy. So some of you will be using injections to manage your type 1 diabetes, whereas others of you will be using pump therapy. And it's just a video to explain the differences because we'll be referring to different principles throughout the course. And sometimes we'll need to make it specific to pumps, and sometimes we'll need to make it specific to those of you using injections. So actually just highlighting the differences so you understand what the differences are. And actually perhaps if you're not on pump therapy, it might just give you a bit of information or a bit more information about pumps and actually whether or not that might be an option for you in the future. So let's jump right in. Now, we know from our previous videos that everyone will be taking a background insulin or your basal insulin. So if you're using injections, that's going to be a steady state amount of insulin dripping into your system over 24 hours. Now, some of these insulins have a minor peak on them, which means you get a little bit extra insulin when you first inject it, and then it starts to die off gradually as the day goes on. But the newer insulins, like Tresiba and Toujeo, are actually pretty fat and are super long lasting, maybe up to 42 hours coverage. Still means you need to take them every day though. Now, pump is slightly different in the sense that we can actually modify this basal rate throughout the day depending on what you're doing. So actually pump therapy doesn't use background insulin in the same format, so it won't use a long-acting insulin. It uses rapid insulin all the time, but the rapid insulin is dropped in using micro doses every minute to achieve that background coverage. Now this gives us some flexibility because what we can do is with pump therapy is increase the basal rate when we need to. So let's say you know you're a bit more resistant in the morning after breakfast and then you go for a run. So we can dial that background insulin right down for the run and the prolonged effect of the run. And then we can come back to baseline for the rest of the day. And then overnight, you know you might have, say, some insulin resistance in the morning due to the dawn phenomenon. So you might even dial it up for a period in the morning. So already we've got a lot more flexibility with that background insulin, because if you went for a run without using pump therapy, once you've injected that insulin, it's in. You can't turn it off. It's just going to do what it does. So then you have to manage your carbohydrate and your rapid insulin doses around that. More on that in later lessons. Whereas we can already see pump therapy gives you a lot more flexibility. Then when we look at rapid insulin, again, if you're injecting it, that insulin is going to be lasting 4.5 hours, regardless of the way we look at it. So we've got a 4.5 hour timeline. Excuse the handwriting, just writing quite quickly. And we know it takes 30 minutes to get into the system, and it takes about an hour to peak before it reaches its peak concentration in the blood. Now pumps, again, have a bit more flexibility here. So with pumps, in fact, let's just draw another one up here, just so it's not getting too messy. So depending on what you're eating, you can actually change how that bolus or rapid insulin is delivered. So rather than just have the standard 4.5 hours, what you can actually do is start to prolong the dose. So you can draw it out over a period of time, or you can deliver more at the beginning and then give a little bit more later. So these are things called square waves or multi-wave doses. We can also stack more insulin at the beginning of the dose. So we actually borrow some insulin from our background insulin. So you turn off your background insulin essentially with something called a super bolus. So you get a big rise in your insulin, in your rapid insulin, and then it dies back off. And after about 2 hours, your basal insulin returns to normal. So this is for those very quick releasing meals that might get into your system quite quickly. So again, gives you much more flexibility with your pump compared to how you might be managing just using subcutaneous injection therapy. So you can change both how your basal and your rapid insulin or your bolus insulin is delivered. There's more functionality than this, but it's just to highlight the differences, just to help you get an idea about the basics of how they work. If you want to find out more, I'd encourage you to speak to your GP and maybe get a referral to an insulin pump team and actually explore really how it might help you. If you're already using it, then brilliant. If it's not for you, then absolutely fine. We stick with the pens. That's fine as well. But it's just to get it clear in your minds about the differences, and actually when we're talking about some of the principles going forward, when I'm talking about some of these things, that's what I'm referring to. So we'll leave it there for now, and we're going to move on to more lessons over the coming lessons with regards to how to adjust your insulin and which foods we need to look at for giving insulin. And then we're going to move into those more advanced strategies as the course develops. So I hope you enjoyed the lesson, and we'll see you at the next one.